Hi, I'm Jessie Gruman, President of the Center for Advancing Health. Almost a third of the people who leave their doctor's offices with a new prescription don't fill it. Half of those who do fill it don't take the drugs as recommended. These individuals are non-compliant. But are they engaged in their health care? Engagement and compliance are not synonyms. I am compliant if I do what my doctor tells me to do. I am engaged, on the other hand, when I'm involved in the process of solving my health problems. This new prescription is one element in that process. I may seek to learn about this medication, what it can and can't do to ease my pain or slow the progress of my disease, what side effects it might produce and what I should do about them, how long it will take to work, when I should take it and how I should take it and how much it may cost and what will happen if I don't take it. I may consider the barriers to taking it and whether there are alternatives, changes in my exercise habits or my diet or vitamins, or I can watchfully wait, and all of their respective risks and benefits. If my provider has done more than just hand me the prescription, she has, for example, raised some of these questions and discussed these concerns with me, I probably won't have a prescription in my hand if I don't intend to fill it. But I can be engaged in my healthcare even if I don't have that conversation with my provider. I can ponder these questions with family and friends. I can search the library and Google for answers. I can consult online with others who've taken that medication. And sure, I'll hold that prescription in my hand just in case I decide to fill it, but I make no guarantees. The rhetoric of engagement is attractive to patients and providers and employers and health plans. It says that we have choices about our health care, that we're empowered to participate actively in it, and of course that we have that it's time to take responsibility for our health. Now, many people who speak about the need for people to engage in their health care imply compliance when they use the language of engagement. They assume that once we realize that it's our responsibility to do so, the only rational choice we can make is to behave consistently with our doctor's directives, whether that means filling a prescription, losing weight, or undergoing surgery. But this is not how many of us receive these messages. The rhetoric says we have choices. We hear you have the power to choose which doctor to consult and which advice you will follow. It says we are empowered to find good health solutions. We hear your web searches and new friends online can help you figure out what to do just as well as your doctor can. The rhetoric says we're responsible for our health care. We hear you are on your own. What we hear is reinforced by reality. A paucity of providers who encourage and welcome our participation in our care, and office visits that rarely allow time for the conversation about the new prescription that I described before. Saying engagement and meaning compliance implies that we are the only ones who must change our behavior. Doing so misrepresents the magnitude of shift in attitude, expectation, and effort that's required by all healthcare stakeholders, us patients, providers, our employers, our health plans, and our government, to transform healthcare so that we can work together to benefit from the available training, tools, and technologies in our quest for better health.